Now let me introduce this model to you. This ECO model, first time I worked on this ECO model was way back in 2012. That was the time when they were trying to develop this model, and they had done a workshop in Lahore in one of the PSG. And then later on over the years they have developed it, but then the development is only up to the D1 level, and it's just a basic model. The idea of development of this model is not to give the exact simulation as it happens inside the body, but to teach the students the basic maneuvers and the ability to understand the basic structures the way I've just said in the conference room. So Shafqat is here with me. He has done quite a few endoscopic ultrasounds. Now if you look at this model, it is like going inside the oral orifice, and from here on this is the point from where the E junction and rest of the structure starts. So for the demonstration model, let me start. We have done the lubrication.
Riaz,
yes,
you are able to, however, understand the clockwise, anti-clockwise movements
right.
and what
Basic,
happens when you advance or pull back the scope. So
that is
the concept.
Exactly, that's the exactly idea of this model, that you can able to understand the basic model, the amount of movement that that is permissible, and the kind of structures that you can see in the black and white imaging. On
So if I'm doing an EUS where I don't smoke,
now I'm introducing my endoscope into the model, and from this point onwards we have the यहाँ से नहीं बटन ऑपरेटेड नहीं कर दे ओके the light to come here. Okay, now you can see that there's a white, there's a black line like this. This is supposedly the abdominal aorta with the uptake, with takeoff of celiac right here. You can see that this is the celiac, this is the aorta, and over here this is the left gastric artery. Little further down you can see that here we are on to the pancreas and the two blood vessels. The one close to the transducer is obviously the splenic artery, the one away from us is the splenic vein. And my cursor is right on the pancreas. One can make the movements, one can slightly adjust right and left, go a little further back, little further down, rotate it while keeping it under the view, clockwise, counterclockwise movements.
it's not about getting just the structure, it's also about understanding what you're doing. What happens when you advance the scope? Is the area of interest going away, or is it going away from you, or coming close to you, or going towards the right?
Okay. Then having a look at the gallbladder. This is the gallbladder. You can see that gallbladder, and then from gallbladder one can rotate. There is a problem with this model. It is not as smooth, as easy as we do in the human beings. We can go into the D1 and we have to push real hard in this. Now here we have the structure like this.
So for example, if I was doing this model and I would want to know what happens.
Now this is the simulation of D1.
This side, move it, bring it here. Okay, what happens when I advance the scope? So that's the concept you get. You really don't get so much time on the patient. You can't spend
ठीक है? चलो.
This was something that was
Out.
actually really imposed upon me in this course by the
each junction.
Riyaz,
जी
just जब आप let everybody here, they want to know what happens when you do a clockwise rotation to a structure. You pick up a vessel or whatever gallbladder you know saw, and what happens when you do a clockwise, what happens when you do an anti-clock, what happens when you advance to the actual structure in relation to the transducer.
Okay. When your transducer is at an X place, when you are trying to rotate to the
Got a
clockwise.
structure right now.
Yeah. I know where exactly he is. Let me just pull back a little right here. And this is the aorta, right? Now, when we rotate, when we make a clockwise rotation, obviously we are going to the right. When we are going counterclockwise, we are going to the left. And this right and left is basically in relation to the screen. Actually, when we are making a clockwise rotation, we are going to the left of the body. So one has to have a imaging inside the brain that this is a surgical and radiological anatomy, and we expect the structure, say we're in the midline, we expect, what kind of structure do we expect on the right of the body, what kind of structure do we expect on the left side of the body. So if we have picked up, say, abdominal aorta, descending aorta, going to the clockwise side, we expect that we are going to the left, and we should be, this is the celiac takeoff. The cursor, you can see that the cursor here, this is the celiac takeoff, and this is the abdominal aorta. Now, if we have to follow if we want to follow the celiac, we just have to slightly push along the celiac, and we are advancing along the celiac, and a slight further push, and we are there at the pancreas. Okay, I was talking about clockwise and counterclockwise. Clockwise from the center, clockwise means that we are going to the left of the body, meaning by that we should be expecting spleen, we should be expecting kidney, adrenal, and the two blood vessels, splenic artery and splenic vein. And then if we go counterclockwise, that means that we are going towards the pancreatic body, pancreatic head, and then towards the hilum of the liver and various segments of the liver.
So if you take this structure that you have, like you did with the aorta,
Yes.
and if you go back to the aorta,
Can you go back to the aorta, please? Yes, this is the aorta. Yes.
right? Now if you do a clockwise, can you do a clockwise and see what happens?
Clockwise.
Okay, and so you're moving more towards the right of the screen.
Yeah, that's right.
Whereas if you take an anti-clockwise, you bring that aorta back and you keep going anti-clockwise.
And slight push, one can see that there is celiac takeoff, and along with the celiac takeoff, slight further push, and we are there on the pancreas.
So celiac, let's say aorta is coming here, celiac is here. So if you go clockwise, you're going to go towards the proximal side, proximal part of the aorta if you want to look at it.
हाँ
Whereas if you go anti-clock, you're going to
ये
go
ये दोनों आगे
distally.
ऊपर आर्टरी
So
नीचे
obviously
वेन.
you will see the celiac artery.
अब आप काउंटर क्लॉकवाइज जाओगे ना, क्योंकि क्लॉकवाइज वक्त देख लिया. हाँ हाँ, बिग व्हील अप एंड स्लाइड.
Anti-clock जा रहे हैं. If a structure is like this and you're moving, so you're going to go
Yeah,
distally
yeah,
for the structure.
that's right. Good.
You're not advancing, but you're going distally, depending on where the structure is.
बिल्कुल ठीक.
अगर ये reverse हो जाएगा in the duodenum, so then
ठीक
when
है.
it reverses, then it will be the other way.
आगे चलो.
यार ये हटाएंगे, ये क्या आ रहा है यार? What is this screen?
Can you appreciate in the audience that the conference that they have shown? Yeah, नीचे डक्टर. Yeah. This is CVD. चलो आगे चलो. हाँ आगे गॉल ब्लैडर पे. Just at the pre-pyloric region, you can see that the bulge, and at the bulge they shown the gallbladder. This is the gallbladder.
If you're fracture
This is another cyst that you've shown.
distally, you will start looking at it. If you want to, if you pull back, you're going to go back to the proximal part of this.
थोड़ा सा पुश करो. Yes. नहीं जाएगा जाएगा, थोड़ा सा रोटेट करने से. यहाँ पे आके मसला है, वो लास्ट टाइम भी मसला था, ठीक नहीं किया उन्होंने. शाबाश, गुड.
Left screen. Screen का left तो
रेजिस्टेंस है, लेकिन ये कि वो थोड़ा सा रोटेट करके तो यू आर एबल टू गो इन. पहले मूवी मैं देख के गया. ये एक लिवर दिखाया ना उन्होंने.
this is
ये गॉल ब्लैडर,
going to be the left of this,
ये गॉल ब्लैडर,
right of the screen there.
ये लिवर की मुख्तलिफ जो वेन्स हैं. हाँ, यहाँ पर रेजिस्टेंस है. और ये लास्ट टाइम यही थी, खराबी इसमें यही थी.
और उसको आपने इधर लाना है तो
तो यहाँ तक बस है इसका एक्चुअली.
and once
तो
you
और पुश करो,
understand this,
हल्का सा यूँ घुमा के लेके जाओ.
you've got a duct, for example, you've got the pancreatic duct. You just keep it in the center. You can, and then just keep on rotating one
कौन
way
सा?
or the other. It will
ये
give
सिस्ट है
all those
उसमें इंडिया.
structures that
सिस्ट है, ऊपर जो है वेन्स हैं. शाबाश.
only if your scope is straight.
यहाँ से आगे डिफिकल्टी होगी. ओके, लेट मी ट्राई. Okay. There you go. ये उसके जो बेसिक लो.
I don't bring it to the
इसको खोल लो.
So that's why I'm saying कि वो बड़ा मुश्किल है. I don't have to. I do it from here because of my. You understand what is that?
कौन सी?
The concept
CVD?
is that this is
वो
exactly what you're
मॉडल
talking
खराब
about.
हुआ तो इसलिए वो
यार CVD with your यही करते
या ये किधर गए इनको लंपस वाले.
But बशर्ते कि scope आपका straight हो. Quite often what is happening is we are trying to do this, but our scope is not straight. So when you're rotating, it's actually not rotating. So the key thing that Khalid is saying is that you know you have to
ठीक है.
keep telling yourself
हाँ,
especially
इसमें इतना ही है बेसिकली.
that
यार इसमें तो वही पुरानी वाली खराबी है. वो अभी भी देखना यहाँ से डिफिकल्ट है
and you're doing
मैंने
this and it's not making any sense.
जो लास्ट टाइम मसला था वो वैसा ही है. हाँ हाँ नहीं, इससे अगर फिर जाएगा भी कोई D2 का उसमें है ही कोई नहीं. दिस इज द मैक्सिमम दैट ये कैप है. दिस इज द मैक्सिमम दैट यू कैन.
With this hand, you know,
ठीक.
whereas you're doing
चलो नेक्स्ट कैंडिडेट को अब और करना कुछ आपको. चलो नेक्स्ट ग्रुप बुलवा दो.
ये निकाल दो उसको.
हाँ हाँ स्कोप निकाल रहने दो. स्कोप अगले को बुलवा दो.
you're doing a lot of you're doing it from
Okay, Dr. Shafkat is done. Can we have the next candidate, please?
Yeah, we can send the next candidate. जो डॉक्टर साजिदा ने ऑर्डर बता दिया उस ऑर्डर में जाते हैं.
Okay, जो डॉक्टर साजिदा ने ऑर्डर दे दिया है, follow that order. They all experienced people.
अस्सलाम वालेकुम. मुबारक हो भाई, आज सवारी. sitting here, but I'll tell you what जितना मैं इसको मुश्किल समझता था, after a little while, and today I can tell you the number of things. I mean,